Hi everyone, welcome to another session of TGIF. Technology has been transforming healthcare, making it more personalized, proactive, and of course connected. Narayana Health, a leading Indian healthcare provider, is not only reimagining care but also transform the way users gain business insights leveraging data. To share more on this, we have Vivek Rajgopal, who plays the lead of analytics and clinical AI at Narayana Health. Hi Vivek, welcome to TGIF.
Hi Arvind, very happy to be here.
Thanks for being here, Vivek. You've been at the transformation of leveraging analytics platforms for gaining clinical intelligence. Could you help us walk us through the journey?
Yeah, so the journey of data intelligence and AI started about 10 years back for us. As we were expanding as a group, we found out that we needed to automate and centralize our intelligence to be extremely efficient and to be able to replicate our efficiency model across new units that we started. Initially, primarily, we just wanted to automate our business analytics portions of it. Over a period of time, it expanded into operational efficiency, clinical intelligence, clinical AI, and clinical research work as well that we've started doing over a period of time.
Okay. So, what's changed in the way users consume data? I mean, let's talk about frontline users.
Um, Within 2 or 3 years of running a data intelligence program, we understood that analytics delivery or data intelligence delivery is as important as building out the data intelligence engine.
Okay.
And we understood that people don't consume data in a single way. There is no one size fits all. And we took inspiration from some of the social media platforms. People consume content the way they want to consume it. The same content will be available on a chat platform, on a video platform. It may be available on a photos or image sharing platform. And different people consume it differently according to their own context. We wanted to approach delivery of data intelligence the same way, where some people consume it through dashboards, some people through reports, some people have data intelligence built into their workflows. For some people, or for the larger set of employees in the organization, they consume it through a zero learning curve, simple to use application, so that you don't need to have a huge army of training personnel who is required to train everyone that is inducted new into the organization. So we have a multimodal delivery system that is largely based on the kind of role a person is playing in the organization and how it fits into their work life.
We've also seen today organizations leverage many of these large language models in terms of gaining business insights. What's been your experience in this journey?
We've been extensively looking at large language models. It brings a huge amount of efficiency to healthcare operations. When we talk about AI, earlier we used to immediately think about purpose built deep learning models or ML models that were solving one particular problem. But now, with large language models, where it is generic and can solve a whole host of problems, it is changing the way care is delivered. And probably we would say that it is delivering more impact than purpose built clinical models that just solve one thing. We are looking at building cases around different stakeholders that are there in the health system,
Mhm.
patients being a key stakeholder, doctors and clinical staff being the next key stakeholder, the payer provider ecosystem, and then the
Okay,
back office workflow. So, around each of it, we have a multitude of bots that manage various things for us. And that is how we are bringing in efficiencies into our system.
great. Nice to hear that. You mentioned about patients. Why
Right.
don't you share some experiences in terms of enhancing the patient experience?
So, when we looked at the patient hospital interaction, the hospital building and the healthcare area is used for a lot of administrative work. So, we wanted to see if every aspect of the patient journey can be supported with an AI bot,
Mhm.
so that someone doesn't have to physically support the patient, which is both cumbersome and eats up bandwidth of the health system. Starting from appointment booking. Now, of course, I see a plethora of conversational appointment booking offerings that are there. So
Mhm.
we were one of the early ones to be able to do that. You can conversationally book an appointment,
Okay.
which will also do a mini triage. If I say I have knee pain and I'm in such and such area, it will automatically find the nearest hospital and the appropriate doctor for that condition within our health system and allow you to book an appointment there,
Okay.
purely conversationally. The admissions process of a patient, which is cumbersome 2-3 hour episode, where the patient will have to bring in a lot of documents. There is a lot of back and forth checking, verification on the day of admission. When a patient has to get into the hospital, that is a lot of stress on the patient and on the health system as well. That is now handled by a bot for us. Once an
Okay.
admission is booked, a bot will reach out to you. Bot will ask for all the necessary documents based on your profile with our hospital system. All the verifications will happen completely online. A bid number gets generated and gets sent to the patient through a text, and on the day of the admission, the patient can directly walk into their room.
Okay.
Similarly, during your stay in the hospital, you may have requests or complaints, and typically what we do is we head down to the nursing station and then we disturb the nurse and say, I need an extra pillow, my room is not clean, light is not working, my
True.
back is aching. And nursing bandwidth goes in handling these issues and resolving it with multiple trips that the nurse has to do. Again, easily can be handled by a bot.
Okay.
So the patient can text the bot with whatever they want. The bot will raise a ticket in our internal ticketing system against the concerned department, keep the patient updated of the status, and take the ticket to closure.
Okay.
Similarly, around the discharge process, around post-discharge feedback, around continuity of care, around your time in our OP. And now we are starting off with conversational agents that can handle pre-assessment of the patients. So several agents that support the patient journey is what we are looking at.
That's absolutely transformative. As you see, Narayana Healthcare has reimagined care, leveraging this portfolio of technology services. That's all we had for today. See you next week. Till then, bye-bye.